Testing, 1, 2. Yeah, like he'll start the committee and call everyone, and then
Well, good morning, everyone. Thank you very much for joining us this morning. And before we start our formal meeting, I wanted to take a moment to make a short presentation. My name is Mark Taylor. I'm the chair of the Community Protective Services Committee. And this morning, on behalf of Mayor Jim Watson, my council colleagues in the City of Ottawa, I have the great pleasure to recognize the Community Veterinary Outreach Program and the city's Spay-Neuter Clinic with a very special honor. I'd like to take this time to welcome some special guests who've joined us today. Dr. Jennifer Messe, representing the city's Spay-Neuter Clinic, Dr. Michelle Lem, founder and director of the Community Veterinary Outreach Program, and Dr. Bernard Pouquet, representing the Canadian Veterinary Medical Association. Anybody who reads the paper, I'm sure, the Citizen, reads Dr. Pouquet's column, and Dr. Messer's brought her mother with her all the way from Montreal to see her get this award. So we're very, very honored to have you join us this morning. In October 2013, at the annual Summit for Urban Animal Strategies in Alberta, the Community Veterinary Outreach Program and the City of Ottawa Bylaw and Regulatory Services Spay-Neuter Clinic were recognized by their industry peers with the Community Collaboration Award. This award, sponsored by the Canadian Veterinary Medical Association, recognizes programs, codes of conduct, or best practices delivered to create a healthier environment for urban animals. It also allows for the opportunity to illuminate successful strategies for urban animals and to acknowledge those who lead. The City of Ottawa Spay-Neuter Clinic was established in 1978 to provide accessible dog and cat spay-neuter services to Ottawa residents. Anybody who has an animal in the City of Ottawa, I'm sure, is familiar with the Spay-Neuter Clinic, and if they haven't used their services, they're certainly aware of them. And to be quite honest, it's a godsend for a lot of our pet owners here in the city. Since the fall of 2011, clinic staff have been working collaboratively with the Community Veterinary Outreach Program to deliver spay-neuter services to the pets of homeless and vulnerably housed citizens. So for those of you who have seen folks who are on the streets and might be homeless or in that vulnerable state and they have an animal with them and you think that animal has no care, that's not true. Because of the efforts of the Community Veterinary Outreach Program, there are services available to those animals. Dr. Lem, the founder and director of the Community Veterinary Outreach Program, established the program in Ottawa in 2003 to meet the growing need for integration of veterinary education and care in the community. Operating from a College of Veterinarians of Ontario licensed companion animal mobile and staffed with volunteers, animals are examined, vaccinated, treated for internal and external parasites, and implanted with a microchip. Owners also receive valuable education and advice on nutrition, dental care, behavior, and benefits of sterilization of their pets. During the past 10 years, over 1,500 animals have been treated and vaccinated, and demand continues to grow for these services. Community Veterinary Outreach uses the services of the city's spay-neuter clinic facilities for its animal patients, and the veterinarians and staff at the clinic perform the surgeries. This service is provided completely on a voluntary basis by the technicians at the clinic. This is a great example of a partnership that reaches out to the less fortunate within our city and provides for the health and welfare of their companion animals. And I would say it's just one other way in which our city demonstrates that it is a caring and compassionate city for all of those who live in it. I'd now like to ask Dr. Messer and Dr. Lem and Dr. Picret to come forward. And on behalf of the City of Ottawa and your industry peers, I'm pleased to present you with this Community Collaboration Award. We're going to hand it off and have a little picture here. All right, well, doctors, collaboratively, congratulations to you on receiving the award, and congratulations to everyone involved in receiving the award and in your program. In closing, and in recognition of the February being Spay-Neuter Awareness Month in North America, Mayor Jim Watson will be proclaiming Tuesday, February 25th, 2014, as Spay-Neuter Awareness Day in the City of Ottawa. That wraps up our presentation this morning, but we want to thank you very, very much again for coming out. I don't know if this trip, you're going to have to do something else for your mother. I don't know if this was worthwhile enough to come from Montreal, but she got a picture out of it. Thank you very much for everything you're doing, and congratulations once again. All right. So, with members present, we're going to get underway at the Community and Protective Services Committee meeting, Thursday, 20th of February, 2014. And we have quorum of the committee. We have received regrets from Deputy Mayor Al Shantiri. He's not going to be able to join us today. We're going to go through a consent agenda. We do have a presentation this morning from our partners at the United Way, which we expect to take about 30 to 45 minutes. So we're going to hold that right off of the bat and move through a consent agenda and see what we can dispose of quickly and efficiently here. So members of the committee, are there any declarations of interest? No, thank you. Confirmation of the minutes, minutes 30 December 4th, 2013. Carried. Thank you very much. Communications, responses to inquiries, CPS 0113, outdoor rink maintenance. Is this received?
Received.
Received. Thank you very much. We will hold the verbal update from the United Way, as mentioned. Community and Protective Services Committee inquiries and motions for the period ending 13 February 2014. Is this received?
Received.
Thank you very much. City Operations, Community and Social Services Department, the Child Care Service Plan. Staff have a presentation for us, and we do have one delegation that has signed up. If there are others in attendance who are interested in presenting to the committee on this, I'd urge you to fill out a form just under that screen by the door over there and get your name on the list to speak. So we'll hold that. Animal Care and Control Bylaw, administrative updates to facilitate pet registration and transformation. Members of the committee received the report as well as a memo that I had sent around on this. Carried. Is there any desire to hold this, or shall we carry it?
Carried.
Carried. Thank you very much. And thanks to Councillor Tierney as well. That the online portion will help streamline. It's an animal day here. It'll help streamline things for animal lovers citywide. That's right. Item number 5, donation of ambulance to the Salvation Army. This was my item presented last time as a notice that the Community and Protective Services Committee waive subsection 41.4 under the city's purchasing bylaw and approve the donation of one ambulance to the Governing Council of the Salvation Army in Canada as detailed in the report. I would remind folks that this is an ambulance that they use to support many of our emergency endeavors and come out. The Moody Drive fire, for example, they were out there for a week feeding our first responders and supporting community members. Is there a desire to hold this for debate?
Carried.
Carried. Thank you very much. There is an IPD, the Painted Up program. May we receive that?
Received.
Oh, Vice Chair Cadre would like to speak to that.
Thank you very much, Mr. Chairman. Just want to make a comment about the successfulness of this program over the past 5 years. And the application date for this year is April the 3rd, the deadline for application for doing more good work in the community. So I just want to take the opportunity to thank everybody that's involved in this program. And as you can, like I said earlier, it's a 5-year success story, and hopefully it'll continue further. Thank you. Thank you, Mr. Mayor.
Thank you very much, Vice Chair Cadre, and thank you for your leadership on that program and with Crime Prevention Ottawa in general. And if you do take the time to read the report, you'll notice that the number of individuals who are engaged in the program has actually been growing over the years. The number of kids, and I always say kids, but there's adults involved too, who come out and participate in that program. So it's great to see that community engagement. Councillor Fleury does have one item which he has some time-sensitive commitments today and may not be able to be with us for the full committee. Now, I had given the committee notice through a memo that there was one item that he wanted to move. So with committee's permission, I'd like to allow him to do that now and then get back to our 2 held items. Is there any objection? So we'll need to waive the rules. Councillor Fleury?
Yes, so this is for the Byward Market Program bylaw amendments. I'm asking that the CPS committee approve the addition of this item for consideration by the committee at today's meeting pursuant to section 84.3 of the procedural bylaw.
So on waiver? Carried?
And then I've shared this with committee, and before I go in, I wanted to recognize members in attendance. So we have members from our markets management team. We have members from the Byward Market Standholders Association, Arts and Craft Community. I think I saw Yasna from the BIA who's back there. So I know that this is a walk-on and we don't like to do that. The reason why we're doing these changes are a couple of elements. One is that contracts for this summer are signed as of March 1st. And if we miss that period, we're basically stuck in the same framework as the previous year. As you know, we want to prepare the market for 2017, and that's a plan we're working towards. But this summer, there's an action plan that was shared with the members. It's a 14-point plan to really try to position the market and prepare it in doing things. So we're going to pilot three main elements this summer, one being the Savor Ottawa stand. There will also be a key area where we will do demonstration stands for food and especially local food in the area. And we'll launch this summer a night market. And for us to be able to do that, we need to do some amendments to the bylaw. So that's what we're doing today, is we're bringing forward amendments that will enable us to pilot things this summer, see if they work. If they work, we'll continue to try to improve the market. And if they don't work, well, we'll realign them. So it's a lengthy procedural bylaw that I shared with you, but the gist of it is really to enable us to do some of the fun pilot things for the summer.
So thank you very much, Councillor Fleury. So there's a number of there are a number of be it resolved, but if we boil it down, yeah, staff are in support of this, and if we boil it down to the summative clause, it's be it resolved that City Council approve amendments to the Byward Market Program bylaw number 2008-449 as set out in document 1 attached, effective March 1st, 2014. Members of the committee, is this carried?
Carried.
Carried. Thank you.
Thank you.
Thank you very much, Councillor Fleury, and congratulations on getting that move forward. It's we all have parts of our ward that are require a lot of management. I know the Byward Market is a big piece of your ward that requires a lot of your attention, so thank you very much. So that brings us back to the verbal update from the United Way, and I would invite down, I believe Rhonda Bradley, Michael Allen, and Jamie McCracken are coming forward. Gentlemen, thank you very much for joining us this morning, and appreciate your time in coming to help inform us about some of the great work that United Way is doing and some of the challenges that it's facing helping our community. Mr. McCracken, over to you.
Thank you, Mr. Chair. On behalf of United Way Ottawa, I'd like to thank the committee for having us here today. This is part of our ongoing commitment to you to inform you and keep you up to date of the progress of our work every year. You are a very important partner for United Way Ottawa, and we really appreciate this opportunity. To give you some context, like many United Ways in the past 10 years, we've had to have a real hard look at the work we do. For many years we were a federated fundraiser, and that meant we raised a lot of money and we distributed it far and wide in our community. But like many United Ways, donors began to ask questions about exactly where was the money going, and they wanted us to direct a line from the gift directly to where it was ending up. And so over the course of a number of years, through many consultations and research, we landed on 10 priority goals in 3 focus areas: growing up great, belonging to community, and turning lives around. And those 10 goals have guided our work over the last 3 or 4 years, and today you're going to hear some of the results of that work and the progress towards those results. What we're about is complex and it's hard, just like the work that this committee does and this city does. In Ottawa last night we were lauded as the second most livable city in North America, but as you know, there are 2 neighbourhoods: the neighbourhood of hope, in which we live, many of us, and of course the neighbourhood of despair, and that's where we direct the focus of our work. We can't do this alone. This is a collective impact area. Lots of organizations and agencies and the City of Ottawa and United Way Ottawa work together to improve the lives of those who need our help in this city, and that's what we're about today. So there's an old Irish saying that says we live in the shelter of each other. And it's with that spirit we come before you today and hope that you will find this presentation both informative and enlightening. Thank you very much for that. I turn it over to Michael Allen, CEO of United Way Ottawa.
Thank you, Jamie. And once again, Chair and Councillors, thank you for this opportunity for United Way and a number of our colleagues within the community sector to be before you today. We are before you today as both staff and volunteers to talk about the work we do, and moreover to begin to scope the number and growing number of intersections that our work has with so many others, but not, of course, the least of which is the City of Ottawa. We see this as an opportunity, as we were urged to do, to continue to demonstrate a growing opportunity, a growing role for United Way to be a voice for the community sector. A voice that we believe is important around tables like this within the context of municipal, provincial and federal governments, to be a voice that is progressive and responsible and reasoned in advocating for the work that is done within this sector. Let me pick up on Jamie's comments for a moment and just ask you to recall the transformation that United Way has been on and the path we have been on. It will be trite to say to elected officials that our path has not been an easy one with with not easy choices, with hard decisions, and the likelihood is that there will continue to be tough choices. That is certainly not news for elected officials. The kinds of challenges and pressures that the City of Ottawa faces are significant, and I'm sure you will hear many of them today, but to combine with issues like policing and crime prevention, Councillor Chadri, I know her work there is very gratifying, with transportation and containment of taxes. All of those challenges are complex and difficult, and I don't envy you those decisions. But nevertheless, the role that we play and that we want to bring to you today is about how our direction and our requirement to make those choices, I believe, is demonstrating now very, very positive results and making a difference in our community. And you're going to hear more from that from the individuals and depositions that are joining us today, and I want to thank them for giving of their time. As you know, our work with the city has many intersection points, and I know that one of our other volunteers, Goldie Hyder, who is a co-chair of our campaign, will be before you in a few moments and will speak to the wonderful work that was done by the City of Ottawa and its employees in terms of our campaign. But we took stock of the number of intersection points that we have with the City of Ottawa, and they are over 30. Different community sector initiatives, common committee participations, common areas of funding, and a common commitment to a number of things that many of which you'll hear about this morning. Successful aging in Ottawa, to help people with disabilities access meaningful employment through an initiative that you know and we know as EARN, providing supports to those who are homeless, battling mental health issues, or experiencing the consequences of poverty. We share a common interest in helping immigrants and new Canadians to integrate successfully. Through Social Rec Connect, we help more children access social and recreational opportunities outside of school. Project STEP, that works very hard at lowering the incidence of youth drug addictions. Together, our investments in the community development framework are helping to develop strength in our more vulnerable neighbourhoods, and through the Ottawa Neighbourhood Study, we are investing in tools and technology that will allow us all to become increasingly smart, increasingly intelligent about what is working and what is not working in our communities. And I might note that most recently, to great fanfare, the addition of an ex officio role to the board of United Way in the form of the chair of the Community and Protective Services Committee, a working partnership that once again brings together the work of the City of Ottawa and United Way. And I want to thank Councillor Taylor for adding his voice to the deliberations of our Board of Directors. The work of your committee overseas is critical to maintaining the kind of Ottawa where people want to live, work, and raise families. How well we do this in areas affects our capacity to attract business and talent, and it bears a direct impact on our collective quality of life. As I said earlier, we acknowledge the difficult decisions that any government has to make in a very dynamic political landscape, a growing and changing community with limited resources, multiple competing priorities, and I commend you to that work. Our job here today is to speak on behalf of the community sector, the important work that it represents, and to be more consistent about that. Please allow me to introduce my volunteer and staff colleague, Jeffrey Dale, who is the United Way of Ottawa's Volunteer Chair of Community Services Cabinet, and Carol Gagnon, our Vice President of Community Services.
Thank you, Michael, and good morning, everyone. Before Jeff offers some insights in terms of some of the results that we've achieved, I would like to put into context what we believe is critical to achieve system-wide change in our community. For change to happen, we have embraced a collective impact approach at United Way. Dans le secteur communautaire, nous collaborons souvent. L'impact collectif va bien au-delà de la collaboration. Il repose sur l'hypothèse qu'aucune organisation n'est responsable des problèmes sociaux majeurs et qu'aucune ne peut les résoudre. The solutions to complex issues require multiple stakeholders. They require government, funders, private sector, service providers, and individuals. These must be expressed through the 5 conditions of collective impact, which is a common vision, common agendas, mutually enforcing activities, constant communication, measuring the same kind of results, and finally, investment in what we call a backbone organization. Laid out like this, it may sound simple, but it's clear that it is anything but simple. To develop what we call a common agenda, a common vision, is often the most difficult step. We feel that we are at a point in the social service sector where we must, as different funders, march towards that vision of developing common vision for our most urgent social issues. Agreement on a common vision does require for us to put aside our individual agendas, does require us to engage civic leaders, the private sector, and does require for us to move towards a changed behavior and indeed align our interest. Mais dans cette communauté, nous savons à ce quoi peut ressembler un impact collectif, car nous réalisons des progrès dans les secteurs où nous appliquons les 5 conditions. I'm going to turn the floor over to Jeff to bring to life initiatives that can be characterized as collective impact and to hear the kind of results that together we have achieved. Jeff?
Thanks, Carol. Good morning, councillors. As Jamie and Michael have mentioned, United Way Ottawa set 10 priority goals in 2008. And to refresh your memories, they are lowering the number of children who start school unready to learn, helping more at-risk children and youth succeed through after-hours programs, create meaningful employment opportunities for people with disabilities, helping more seniors maintain their independence and stay active, supporting people living in vulnerable neighborhoods, bringing immigrants and new Canadians together with employers to find jobs that match their skills, helping more homeless people off the streets through Housing First initiatives, connecting more people with mental health and addiction issues with the supports that they need. And our last one is providing support and treatment for people and families in crisis. Many of these issues will sound very familiar to you. In many cases, they are issues where our work intersects or where we are already collaborating. In some of these areas, we are making progress. In others, we still have far to go. I would like to bring you some of the specifics, and we've brought with us later copies of our most recently published results report. But what I can tell you is that in the areas where we are adopting a collective impact approach, we are beginning to see true positive change. Let me offer you one of our most promising examples to date. This example begins with a couple of facts. 1 in 6 people with a disability live in poverty. Ottawa is about 17% behind the national average in terms of engaging people with disabilities in our workforce. The long-term view of Ottawa's labour market projects an impending skills shortage as labour demand surpasses supply, meaning that Ottawa has to enhance our productivity of our labour force in order to be able to meet our growth requirements. From any perspective, this seems to be an area in need of our attention. To that end, a couple of years ago, we convened a number of community stakeholders and formed a local initiative known as EARN, Employment Accessibility Resource Network, of which the city is a member employer. Simply put, EARN is a community initiative that brings together more than 30 employers, service providers, funders, and government leaders with the express goal of increasing opportunities for meaningful employment for people with disabilities. By providing these employment opportunities, we are not only helping people with disabilities find a pathway out of poverty, we are helping employers access a virtually untapped talent pool, and it's increasing the likelihood of them finding the right person for the job. EARN remains still in early days, but our collective efforts so far have yielded some great results. We have helped over 1,100 people with disabilities to access employment supports. We have helped 453 people with mental health challenges participate into vocational supports. We have delivered over 20 educational and networking events since 2011. We have provided resources, advice, and information to over 140 HR professionals. And we have helped over 85 people find employment within the National Capital Region. We have far to go, but we believe that this model is an effective vehicle for large-scale, community-wide system change. We would like to see the methodology applied to a greater number of community-wide issues because we believe that where it is applied, we will have far better results and our community will move forward with better outcomes than any of us could achieve alone. With that, I thank you.
Thank you, Jeff. As you can see, our theme today is measurable outcomes and collective impact. And to that end, we brought with us some senior leaders in our community who will testify to this fact. So with your indulgence, I'd like to ask them forward to give some further elucidation on these matters. Thank you.
Thank you very much, Mr. McCracken. So I believe first is Goldie Hyder, co-chair of the United Way campaign. Goldie, if you want to come on down. And just as a reminder, each speaker has 5 minutes, and then we'll hold for questions afterwards from members of the committee. Whenever you're ready, Goldie, the floor is yours.
Great. Thank you very much, Mr. Chairman. Good morning to you. Bonjour and assalamu alaikum. Let me begin by offering my appreciation for the tremendous campaign work done here by the City of Ottawa, led by Dan Chenier, yourself, Mr. Chair, Mark Taylor, and Matthew Fleury, my predecessor. When they said next generation to him, I guess they really meant next generation from you to me. I was privileged to speak at the launch here back in September, just down the hall. And as a citizen, I want to say thank you for leading by example. When I was asked to be co-chair of the United Way campaign with Barbara Crook, it was quite an honor and certainly very humbling. Part of what attracted me to the community, to the opportunity, though, was a chance to make a difference, not just in the community, but to the future of the United Way. My business perspectives drew me to the role, as what I have seen in the private sector is now occurring in the nonprofit sector. Change has become a hallmark of my business. There is now more than ever more and more demand for evidence-based decision-making, measurement, transparency, a sharp focus, and accountability have become prominent dynamics of my world, our world. This approach is now greatly needed in the nonprofit sector. I see this in the change the United Way is undertaking. During my presentations and discussions with donors, this transformation resonates with them. I see similar themes also resonating with taxpayers. Both want, rightfully so, a strong return on their investments. Setting this year's campaign goal was an important milestone in the history of the United Way's campaign. It was a move to become clearer, more transparent to the donor, more accountable for the results donors are helping us achieve. After 80 years of setting financial goals based on the financial capacity of the donor community, a very significant shift has taken place this year that sees the campaign put the focus on what is needed and how many lives can actually be changed for the better. Now, this seems simplistic enough, but it actually represents a very fundamental paradigm shift. In the political arena, they say money follows message, and that is not any different in the nonprofit sector. We are the nation's capital of a resource-rich, wealthy G8 country, but despite that, we know that there are, in effect, two Ottawas. One which lives just fine, and another where there are growing needs and ever-expanding demands for support. United Way and its partners strive to bridge that divide and stem the tide where too many people who need the help the most run the risk of being left behind. As Barbara and I visited the various agencies supported by the United Way and we spoke with the people who benefit from the services, what struck us most is their strong desire to turn their lives around. to be able to stand on their own 2 feet. People do not end up in these situations by choice. It is a part of our nation's promise to help them find their way forward. What I see in the eyes of people I've had the privilege to speak with, whether new immigrants or teenage mothers or runaway teens, seniors suffering in crisis, in loneliness, people with mental health issues or those with physical and intellectual disabilities, is a strong desire not to be dependent on others, a human instinct to want to take care of themselves and be contributing members of society. At a time in which we are at the front end of emerging labor shortages, we will need every productive person we can find, and there is no better place. There is no better place than to start right here with those in our community. They know that the status quo is not an option, and we know it too. However, what I can say is there is a perfect storm brewing out there, which is going to make things more difficult, and the choices before us even more so. Yet the burden of leadership, whether for you as elected officials or for organizations in positions of leadership like the United Way, it is our responsibility to chart a course forward despite these challenges. These are in many ways defining moments for our city. Will we get ahead of it? If so, with respect, I would suggest to you the time is now to make some of those tougher decisions and be prepared to change things up. We need to be prepared to take bold steps forward. Try new approaches, adopt best practices, explore innovative solutions, such as social impact bonds, just to put one idea on the table. The benefits are there for all to be had, and people are counting on us to build an even better Ottawa, one Ottawa. Thank you.
Thank you very much, Mr. Hyder, and I don't think you'll get any disagreement from us that there's a desire to move forward in that direction. Members of the committee, are there questions for Mr. Hyder, or shall we move on? Oh, thank you very much.
Thank you.
The next presenter is Joanne Lowe, Executive Director, Youth Services. Ms. Lowe, if you want to move down to the front, you have 5 minutes from when you begin. Thank you.
Thank you for the opportunity to speak today. I'm very delighted to be here today to actually talk to you a little bit about a very particular collective impact set of circumstances and approach that we've undertaken in Ottawa. The possibilities and opportunities to effectively and meaningfully change our community are, in fact, limitless in Ottawa in many ways. Where there is a common agenda, where there's a common problem, there tends to be a common agenda towards solving it. We all know that Ottawa is a highly collaborative community, so this approach comes quite naturally. One significant example of this is the Suicide Prevention Network in Ottawa. I happen to have the honor of being the co-chair of that network, and YSB has the honor of being one of the backbone organizations for that organization and that work. Suicide, very sadly, is the second leading cause of death among 10 to 24-year-olds in Canada. As a community, we try to make meaning of a death by suicide. The impulse to attribute the tragedy to one issue or one set of circumstances is sometimes appealing. The reality is that suicide is a shared, complex issue that requires considerable collaboration and a very comprehensive response. These were the factors that were the impetus to bring together our network of more than 60 organizations and individuals in this community, representing a very broad spectrum of those organizations and interested people in our community to solve this particular issue. Together, we committed to spending 3 years focusing our efforts on preventing youth suicide. We used a very targeted and meaningful approach, and the impacts speak for themselves. United Way and the City of Ottawa are key players and key contributors to the work of the Suicide Prevention Network. Together, over almost 40,000 youth parents and service providers have attended and benefited from presentations where they've learned how to prevent suicide in schools, in their communities, in their families. almost 1,400 staff across agencies attended professional development opportunities that allow them to develop a common assessment and understanding of what they see in front of them when a young person is presenting with suicidal thoughts. Over 600 focus groups with youth were conducted to ensure that we were on the right track. 76,000 Know What to Do guides have been distributed in this city in less than 2 years. These are only a few examples, but perhaps the most long and lasting impact that we've achieved is, in fact, adopting the collective impact approach, having a shared vision for change, having a common interest, and I think in particular attributing more of a non-competitive approach that reinforces all of our activities collectively as opposed to individually. That we've developed a strong and ongoing communication through knowledge exchange. One of the elements of a collective impact that you've heard a little bit about before you today relates to having common data or having common indicators. I would urge you to, I'd like to give you just a very small example of how that impacts our organization. YSB is a multi-service organization. We have 350 dedicated, passionate staff working across 20 sites in this city, providing services to more than 3,000 young people and their families each and every month. We have 8 different funders that cross over 26 programs among all our 4 service areas. Each one of our programs has required a separate contract that for the most part requires us to report on different set of outcomes, outputs, and indicators. If all of the funders could agree on some core indicators, perhaps 5 to 10, share them across all of the requirements, particularly as they relate to housing and mental health, for example, that would be an outstanding example of collective impact approach that would ultimately redirect funds, I believe, and we believe, to change the trajectory of young people's lives in this city. Thank you for your time.
Thank you very much. Ms. Lowe, I have a question for you. As a service provider, I mean, you work in partnership with the United Way, but you're one of those organizations that's the boots on the ground. So with respect to that collaboration that you just spoke of, in your opinion, what's the, what is the willingness or the openness to adopt kind of that shared vision or shared kind of set of practices or principles among the service providers? And I know they run the gamut from, the very small service provider who's basically, 1 ED and 1 staff, all the way up to, large organizations like yours. But, is there, in your opinion, are we at a point in that kind of service community where there's a willingness to be open to that kind of thing?
Absolutely. I've given you one example. You're about to hear another one from my colleague, Cherry Murray from Crossroads. But what I would say is that we didn't have to do an ounce of recruiting for the Suicide Prevention Network. People came because they wanted to, because they were interested, and in less than 3 years, we've actually gone from about 40 organizations to having almost 60 now. So if that says anything, that speaks volumes. I think that as an organization, and I know that YSB is not alone in this, that we understand that in order to actually change lives and change pathways for people, and particularly for young people, we actually have to own the issue as a collective. Otherwise, we're not working on the same path towards the same goals. So I think that the interest, the willingness, and the passion to work collaboratively is very high in this community.
Hey, thank you very much. Members of the committee, are there any other questions? Thank you very much.
Thank you.
Next up is Julian Hanlon, Director of Education, Ottawa School Board. Come on down, Julian. You have 5 minutes from when you begin, and thank you very much for joining us today.
Thank you, Mr. Chair and members of Council. And as mentioned, I'm the Director of Education with the Ottawa Catholic School Board. And this morning I want to talk to you briefly about a project that we're very actively involved in, a very successful project entitled Project STEP. And this project in partnership involves various levels of government, private sector funders, service providers, and the 4 publicly funded school boards in the city. And the main focus of the project is to address substance abuse in our schools and in our community amongst youth. And I'm sure, as you can appreciate, substance abuse is an issue that knows no boundaries, and every high school in Ottawa deals with it on one level or another. So a little bit of background about this unique partnership. In 2005, the directors of education of the 4 publicly funded boards identified substance abuse as a key issue in the schools and one that needed to be addressed. And at that time, there was no strategy or coordinated strategy to deal with the problem. A number of things happened during that time period. One of the things that did happen in 2007 was United Way, with 11 other partners, launched Project STEP to work collaboratively to address the need for support, treatment, education, and prevention, thus the acronym STEP, of substance abuse issues facing youth in our community. Before Project STEP, Ottawa had no residential facilities to treat youth in the city. By 2012, Project STEP had raised the required $3 million to build 2 residential treatment facilities, the Dave Smith Youth Treatment Centre for Anglophone youth and Maison Fraternité for Francophone youth. With this milestone achieved, Project STEP now focuses on the same 4 areas: treatment, intervention, education, and prevention in our schools, and we've also expanded the program from the regular high schools into our non-mainstream school setting as well. And I'm pleased to report that today there's a coordinated system in place with Rita Wood Addiction and Family Services providing support to English schools and Maison Fraternité providing support to Francophone schools. There are substance abuse counselors in every one of our high schools in Ottawa. Services have also been expanded to include the Wabineau Centre for Aboriginal Health, Youville Centre, which is an education site for teen mothers, and there's also a classroom and academic achievement center at Operation Come Home for youth, for street youth. They all have substance abuse counselors working with them as well. United Way and the Ottawa Network for Education, ONFI, through a part of their organization called the SAYS Coalition, Substance Abuse and Youth in Schools, they function as the backbone of the organization and work on behalf of the funders and service providers to provide the coordination, communication, and of course the fundraising efforts. So in terms of funding this, there's no Ministry of Education money coming to this project at all. So funding comes from the 4 school boards. The 4 publicly funded school boards provide substantial funding: the Ontario Ministry of Health, the Champlain Lynn, Ottawa Public Health, as mentioned, United Way Ottawa, the Ottawa Sens Foundation is a key partner, and ongoing fundraising efforts. And we're just in the process of increasing the fundraising efforts again, and both Senator Vern White and MP Morel Belanger, who spearheaded the last campaign, have agreed to help out once again with the fundraising efforts. So some numbers about the project. In the non-mainstream, the 3 non-mainstream settings I mentioned, over 248 youth were counseled last year. In total, over 6,000 youth received prevention and health promotion activities, and just as important, over 500 parents got the support they need in working through the schools. And as mentioned, every high school in the City of Ottawa is part of this program. There's been an extensive evaluation of the program, and there's been some incredible results. 3 of 4 students in the sample group were able to reduce or stop using 1 or more drugs. 70% of the clients who had previously used cocaine or ecstasy reported they've achieved abstinence from these drugs. And the next one, I think, is probably one of the key ones, is 92% of the students who engaged in the program completed their school year, which is a very, you're all familiar with dropout rates and so on. So for 92% of those students who are dealing with substance abuse issue to complete the school year is an incredible statistic, and one that means a lot to those of us in education. In the non-mainstream settings, 71% of the youth reported reduced frequency. 60% of the 165 participating students improved their living condition. And I think just as important, the 85% of the youth felt better about themselves, which is a key factor in terms of moving ahead. Self-esteem is a huge factor in terms of success in school. In November 2013, Project STEP was awarded the 2013 EVAS Award for Ending Youth Homelessness. This $25,000 award recognizes Canadian organizations that demonstrate leadership in preventing, reducing, and ending youth homelessness. Project STEP was one of 4 recipients selected from among 67 applicants across Canada. This partnership is unique to Ottawa. It doesn't exist in any other city, and it goes a long way to ensuring that all students in the city will be successful and the long-term goal become contributing members of society. So thank you for your time this morning.
Thank you very much, Julian, and thank you for the work that STEP is doing and that you're doing at the school board.
Thank you.
Members of the committee, are there questions for Mr. Hanlon? No. Thank you very much.
Okay, thank you.
Next is Sherry Murray, Executive Director of Crossroads Children's Center. Sherry, you have 5 minutes from when you start. Thank you very much.
I'll go fast. Good morning, councillors. Thank you very much for this opportunity. And I'm excited to get to speak to the question that you asked a little bit earlier, Mr. Taylor, because that's what I wanted to talk about. I'm the chair. We have a child and youth mental health network that's made up of all the organizations that serve the core mental health, but we also serve the most complex needs in the community, and so we have representatives from all the organizations. And about 4 years ago, we began to realize that each one of us could have some impact, but together we could make all the difference. And so we looked at the issue of collective impact. We looked at the kind of principles that you've heard about. We developed a common sort of set of values, and we committed to forming a system of care. And the first thing that we did was we agreed to all the things that you've heard about. We have common measurement tools, we have accountability, all of those kinds of things. But we went a step further, and we decided that we were going to evaluate how we actually worked as a system. And we found a tool, and we evaluated us as a system, which I don't want to skip over, because to answer your question, that meant that each of our organizations had to develop the training to do it, and we went into each other's organization and evaluated each other. The outcome was a systems evaluation, and we looked at the kinds of things that we were doing well and the things we weren't doing well that we needed to address, and all kinds of actions came out of it. One of the fascinating things is that we have achieved the goals that we set for ourselves to a level that we never expected that we would achieve, and that was exciting. But the other thing that happened was the many unexpected achievements that we had. And so, for example, one of the things that parents said to us was that you all use different approaches, you do different things, you set different goals. Can you talk together in a different way? So we came together and developed one model and committed to using that one model to address that one issue. But what began to happen is the school boards came to us and they said, well, what are you doing? Because we're seeing fewer suspensions, we're seeing more kids staying in school. Can you train us to do what you're doing? And we did. School resource officers came to us and said, well, we're seeing a big difference in the kids in our school. What is it you're doing, and can you train us? And we did. Even recreation came to us and said, you know, the kids are doing better in the recreation programs and camps. Can you train us? And they did. And together we have a common table where we get together. There's about 30 organizations a week that meet to go this forward. That's just one kind of example. I think I could give you many others. You can tell that I'm quite passionate about the results of this. We have a Crossroads program that's funded by United Way, primarily, that works with the fire department and works with the police department. And not only has that program been able to deliver the kinds of things that we're specifically funded to do, but because of the collective impact, because of the system that's behind us and working with us, the outcomes are much better than they ever would be alone. So I would just add my voice to urging you to thinking about, and to let you know that there's a lot of learnings out there in terms of how to do this, and not only the effectiveness is doing this. So thank you very much.
Well, thank you, and I appreciate that insight into the kind of the collaboration and information sharing that's going on at the organization level. I mean, I think that's great. I mean, that's exactly what we, you know, as a funder ourselves and as a player in the helping people business, I mean, that's exactly the kind of thing that we're hopeful for working with the United Way and the other service partners to try and achieve. I mean, I don't think any one of us has the right answer, the right formula. I think it's probably a combination of all of those things. And it'll evolve over time. So we have to constantly keep our organizations open to looking at how to change to reflect the reality. So thank you very much. Are there questions No? Okay, all right, thank you very much. The next speaker is David Hole. Mr. Hole is Project Coordinator, Knowledge Broker at Ottawa Neighborhood Study. Come on down. And for those of you who don't know, the Ottawa Neighborhood Study is a wonderful I'm sure he'll pitch it, but it's a wonderful demographic tool. Kind of lays out who's who in Ottawa and where's who in Ottawa. And I know some of my council colleagues, as well as myself, make use of that information to help inform our communities about the people who live around them. So, Mr. Hole, go ahead.
Well, thank you for that. Thanks for that, introduction. It seems to me that with that introduction, half of my presentation is already spoken to, so this should go really fast. Thanks for this opportunity, though. The Ottawa Neighborhood Study actually began as a research project out of the University of Ottawa, and their academics were really interested in understanding the socio and economic indicators of health and well-being in local communities in the city of Ottawa. But what began as pure research has since morphed into something very, very different. So over the space of the last 6 or 7 years, the University of Ottawa has forged very successful partnerships with the Champlain LHIN, with Ottawa Public Health, with other planning departments within the city of Ottawa, the community health and resource centers, and United Way, that have been a tremendous supporter and has been our primary funder for the last 3 years. And the change, the morph, if you like, is that we've moved from research to applied research, which means enough about numbers. Let's talk about what the numbers mean. Our mission, if you like, has been to provide relevant and useful and trustworthy information about Ottawa neighborhoods that are going to support place-based planning and service delivery and advocacy and action. And to provide opportunities for dialogue about what makes neighborhoods healthy and improve the well-being of people living in those neighborhoods. I'm not going to talk any more about the study. I do know that many members of council are already very familiar with the study. People in yourselves and people in your offices regularly consult the data that we've collected about the neighborhoods within your various wards. Anyone in the room that would like more information, I'd refer you to our website, which is neighborhoodstudy.ca. I was introduced as a knowledge broker, which is a fascinating little title. It doesn't appear on my business card as such, but I broker knowledge, which is to say that if, like me, in so many ways, numbers just make your eyes cross, and data, you recognize the importance for supporting evidence-based decision, but data really doesn't set your heart racing. My job is to make sense of that data for you, to put it in context that can help you make evidence-based decisions. I'm working constantly with business improvement associations, local community organizations, and community agencies with local planning processes and place-based planning. I wanted to get back, though, to the topic of collective impact and the importance of that kind of an approach. There's been discussions here about the importance of a shared vision, and that requires a shared language. And if we're talking about evidence-based decision-making, how scarce resources get allocated to have the best possible impact and the best possible outcomes, there needs to be a shared language of data. And one thing the Ottawa Neighborhood Study has been able to contribute to this kind of a model is a set of clearly defined indicators and dimensions that can be adopted by organizations when they're going through the business of determining what their baseline data is going to be for a particular issue or project that they are addressing, and supports them to track change over time. So it supports that trend analysis. We also provide the tools for communities to plan meaningful and measurable improvements at a neighborhood level. The other thing is that we provide a common language of geography. We've put a lot of energy into analyzing the city of Ottawa into 108 different neighborhoods. Increasingly, that geography has been adopted within City of Ottawa departments to help support local planning. The other element about a shared measurement system and the role of backbone organizations is that increasingly the Ottawa Neighborhood Study, despite our own scarce resources, has become a backbone organization for so many agencies that have increased demands for program evaluation. Not surprisingly, many funders are interested in funding services. They want the boots on the ground. They want clients to have positive results. But they also want demonstrations of those results, and so often evaluation programs are not part of the funding formula that agencies receive. Small organizations, sometimes with less than half a dozen people, just don't have the capacity to do meaningful planning that's evidence-based. And what the Ottawa Neighborhood Study does, and the City of Ottawa increasingly through its open data strategy, is providing data that can be readily accessed, and with the support of people like me and others within the ONS team, can find ways to use that data for local planning and to populate the various evaluation reports that are asked from multiple funders. So that backbone organization role is just really, really important. I can't emphasize it enough. The City of Ottawa is very familiar with that. Over 40 years ago now, you chose to invest in local coordination organizations, the community health and resource centers. No dollar was better spent, in my opinion, but those local hubs for planning and coordination continue to stimulate community dialogue and local community development for the communities best in need. My time, I have 43 seconds just to address very quickly some of the impact items that ONS is currently working on. Within the City of Ottawa, our data and our time has been supporting the work that you'll be hearing later on this morning related to childcare services and priority setting there. Next week, we'll be working on the Healthy Kids Challenge and the development of proposals. Within the Public Health Department, we've been very happy to work in partnership around defining access to healthy foods and analyzing food deserts. We're working to identify affordable housing within the city. Right now, we're working very closely with COWI, the City for All Women Initiative, and with the Community Health and Resource Centers that are wanting to better understand how to improve voter participation in low-income neighborhoods. And what's the challenge there? Don't they care? Don't they understand? What's the issue such that, well, number one, is there in fact reduced voter participation in those neighborhoods? We have the data that can help trigger these kinds of discussions, but also what are the factors that might impede someone that was even motivated, interested, and informed as a potential voter from actually casting their vote? What's the closest bus stop? Where's the closest polling station? Is childcare available at the polling station? Those are the kinds of issues that we will gather the data and work with COWI to further analyze to inform that particular study, which hopefully will also inform elections, Ottawa process, and those kinds of procedures. That's all I have time for. Like I say, if there are any questions, I'll be very happy to respond. Thanks to the city. Thanks again to United Way for helping make this happen.
Thank you very much, Mr. Hull. And so it doesn't sound like you have a lot on your plate at all.
Not at all, no.
I would ask, you know, when you were talking, you got on a bit of a riff about the necessity of the not just the tracking of the data, but also that shared language and that shared interpretation of, you know, what results is it that we're trying to measure. And I know that there, you know, not just through your operation and, you know, Councillor Tierney's push to get more open data from our end out there as quickly as possible. But there's always, no matter how fast you pump out the data, I mean, it's reflective of real-life transitions. So sometimes there's a lag time, and I'm wondering what your thoughts are on that. I'll give you an example. You know, we used to fund, and we continue to fund, homework clubs, right? And it used to be thought that, well, if you funded a homework club and kids came to the homework club, that obviously means success. The homework club is needed because there's kids coming to it, and it's full. And a fully subscribed homework club is successful. An oversubscribed homework club could even be more successful. It could be demonstrative of more need. But I think even at present, we're measuring, you know, and I didn't get the opportunity to use this example with Mr. Hanlon, but, you know, at present, we're measuring the number of kids in the club. there's got to be a point at which we say, yeah, but did their grades improve?
Yep.
Right? Did we measure that? And is that really the actual measuring stick with which we should use? Is there value in the homework club? Or is the homework club built in the right fashion? Right? So, and that's just one isolated example. There's so many others where it's, you don't measure enrollment, you measure, completion, that kind of thing. But it requires the child to go through the homework club and be graded after the fact, and those are longer timelines. So I'm wondering, what your interpretation then is of, from a funding perspective, whether it's the city or the United Way, they have to provide, you're urging that we provide funding for that evaluative piece, but there's obviously longer timelines associated with that. So I'm wondering what your thoughts are on that.
Well, I've got a few thoughts on that, quite frankly. One is to assemble data that can reliably inform a trend analysis is challenging because year over year, sometimes the ways in which that data is collected can change. And we've seen that with the census this year, and especially the Canadian Household Survey. It's really hard to match up the 2011 data with the kind of data that was reported in 5 years earlier. So that's the first thing, the importance of maintaining that the common definition for any given indicator over time. The other thing is that it's really hard to pinpoint a particular intervention as being the reason for a particular change that might be noted. So in the case of participants in homework clubs who may or may not improve their grades within school, if there is an improvement in grades, to what extent can that be attributed to the homework club participation as opposed to any other kind of activity or intervention or family change or income change or whatever it might be that might indeed have had the same kind, a similar kind of impact. So it's very challenging to interpret statistics. We're constantly looking for new sources of data, and quite frankly, education is one area where I think Ottawa Neighbourhood Study is fairly weak. And we'd like to have further conversations with the school boards about a data sharing agreement with them. We can identify what kind of data can be shared.
Okay, thank you very much. Committee colleagues, are there any questions? No? Thank you very much, Mr. Hall. Appreciate that. Our last registered speaker is Keenan Weller, who's co-leader director of communications for Live, Work, Play. Keenan, welcome back. Welcome down. You have 5 minutes from when you begin. We look forward to hearing from you.
Thanks, councillors, for the opportunity. It's about 19 years ago today, in fact, that my wife Julie Kingston and I co-founded Live, Work, Play, a charitable organization looking to make a difference in the lives of people with intellectual disabilities, their families, and indeed the entire Ottawa community. Back in 1995, the way our community invested in helping this population was comprised almost exclusively of a variety of systems-oriented and sheltered environments. Education, recreation, housing, and daytime activity taking place in venues that separated citizens with intellectual disabilities from other citizens. Live, Work, Play was formed because teachers, parents, family members, disability advocates had a vision for a different type of community, one that believes in possibilities, not limits. They believe they continue to believe in an evidence-based approach that is focused on the assets and value of people with disabilities rather than needs and deficits. They believe that support should focus on removing rather than avoiding barriers of difference that reduce access to life opportunities. Almost 20 years later, many things have changed, but some remains the same. Policy statements and mission statements speak of belonging and inclusion, but in practice, much of our community investment remains focused on infrastructures and systems that serve mainly to keep certain people with disability labels separate from others, rather than helping them belong and contribute to the everyday life of our city. The dominant housing model remains that of congregated residences. Special classrooms and special schools continue to separate some children with disabilities from other children. Even with respect to sports and recreation, we're still learning to play together. It's with these realities in mind that I am an enthusiastic United Way Ottawa volunteer, serving as a focus area champion for belonging to community for the past 2 years. This focus area includes priorities related to seniors aging in their own homes, employment of immigrants and new Canadians, citizens working together to improve their own neighborhoods, and lastly, the priority I'm proud to serve, the employment of people with disabilities. A job is not everything or the only thing in supporting people to live in this community as welcome and valued citizens. However, In making this important transition to identifying and tackling community priorities, United Way Ottawa correctly identified employment has enormous potential for impacting not only the lives of employed individuals, but for helping change perceptions and realities for all citizens in relation to ability, poverty, dependency, respect, and value. You can see the results on the United Way Ottawa website. Individuals with disabilities, once told early in life they will never work, proudly celebrating their first job and their first paycheck. This is where I wish to make the important connection to collective impact, as introduced by previous speakers. It's not possible for a social service agency like Live Work Play to unilaterally develop employment opportunities or create the conditions for employers to seek out and recognize the business case for hiring people with disabilities. We require unity of thought, messaging, and purposes from government at all levels, as well as from private sector partners, the nonprofit community, and formal and informal advocacy networks. We must take special care not to work at cross purposes. I appreciate the City of Ottawa is a member of the Employment Accessibility Resource Network and a supporter and contributor to the EARN Annual Conference. I believe, however, we're only scratching the surface with respect to the potential for United Way Ottawa and its partners to work collaboratively with the City of Ottawa and its many programs and partners. Together, there is much more we could do to ensure consistent messaging about the value of citizens with disabilities, also to evolve practices with respect to housing, recreation, transportation, and other city services in ways that will promote inclusion and align with the progressive efforts underway with respect to employment and ultimately lead to reduction and elimination of the many barriers that currently stigmatize and marginalize citizens with disabilities. In closing, I want to emphasize these changes benefit all citizens. Our community will experience improved physical and mental health, we'll have more productive workplaces, and our neighborhoods will be safer, stronger, and more accessible for all. Thank you.
Thank you very much, Keenan. Are there members of the committee who have questions for Mr. Weller? No? Thank you very much for coming down. That concludes the delegations on the United Way's presentation. And I have some thoughts to offer, but I think Councillor Fleury beat me to it. He has some thoughts he'd like to share.
I felt like I could have asked questions to all the members, and I don't want you to individually feel like we're uninterested. Actually, quite listening and intrigued by some of the discussion. As you know, I'm in the bubble of United Way, so I kind of know a lot of the discussion and the progress and the shift. And I mean, for my colleagues and maybe for people that aren't as informed or as engaged in United Way, I think part of the discussion is now you've seen some of the information related to data capturing, what's the situation, giving us that vision. Then there's obviously the three pillars that allow us to enaction and work with the organization. But in summary, in my mind, what that does is really it highlights kind of the core issues, and then it enables us to respond. It respond in two ways: respond to people that are in need and vulnerable, and then able to create kind of a filter to capture the vulnerability before it becomes a bigger problem. So, we have to recognize the progress, and we have to also recognize some of our challenges. And I think United Way is working on both fronts in trying to really make Ottawa a friendly place for all. And I think sometimes as a city, individually we'd like to do more and support the organizations as much as possible. I think the key word here is making sure we don't duplicate, and that we support each other in key initiatives that meet the common vision. So I really feel that the conversation is happening and that we're heading in that direction. I really want to applaud the volunteer time from the members of the group that presented today, and obviously from the overall community of United Way is not just a fundraiser, it's also an action enabler in our community. Thank you.
Thank you very much, Councillor. Does anybody else have any questions, comments, thoughts? No. Thank you very much to the United Way for coming out today and offering us this presentation. I think, especially to the members of the media who are here today, this is the mechanics, the behind-the-scenes part. If you look at community service in the City of Ottawa as a giant machine, and on the one end you have popping out successes where we're helping folks who are facing some pretty significant challenges in life. The inside of the box is how well the cogs mesh together. And each one of those cogs represents, a service organization, a city, a funder, perhaps the United Way, maybe it's the Community Foundation of Ottawa. And I think our goal in the years to come has to be to better share information, expand and actively look for every opportunity to share information and partner even closer together, as well as define the responsibilities among ourselves, have those frank conversations among the funders and the partners. And I think you heard a lot of that today from the presentation. There's broad desire among those out there doing the good work of helping those who are in our community who are in very vulnerable states. There's a broad desire among them to work collaboratively together. So it's not an issue of territory protection. Perhaps it was at one point in the past, but I think we've moved well beyond that now, and we're into the area of we're looking for collaborative solutions. So whoever's got the appropriate tools to help a person in need, that's who we need to bring to the table. And so I want to thank the United Way for its efforts in doing that. I know that quite often we look at the United Way as a funder, and I think Mr. McCracken had raised that. We were a federated funder, and that's still how a lot of people view us. But the collaborative part, the getting folks to the table to have the conversations and to forge those partnerships, I think that's key to what is going to help enable the future of provision of service for those in our community who are facing some significant challenges. So thank you to the United Way members who've come today and the service organizations who come to speak to us. I'm going to be seeking to come and speak to their board to provide kind of a city view for the members of the board of the United Way to try and highlight, for both organizations the importance of that sharing of information. So members of the committee, this was a presentation on our agenda, so may we have a vote to receive this item? Received. Thank you very much, and thank you again to the members of the United Way who came out. That leaves us with one item on our agenda today. It is the child care service plan brought forward by the Community and Social Services Department. Dr. Burry is here to provide us with a presentation on that. And as we prepare for that, we do have some speakers. We've added a few more. I think we have 3 speakers now on that. The committee has received some communication by email as well, which has been circulated to committee members. I want to thank Councillor Wilkinson as well for joining us. I know she has, well, she's not on CPS. I know she has a very deep interest in child care. But regardless, thank you very much for coming out. And this service plan will move us, I think, take some significant steps to move us in a very constructive direction towards changing the nature of how a child service provision happens in our city, but in a good way. And I want to thank Dr. Burry and his team for having a very, very wide consultation with members of the child care services community and parents. And I attended several of those meetings myself, and it was interesting to see the feedback from parents, from child care service providers who ran the gamut from the not-for-profit, the for-profit, the non-profit sector, to hear what the reality is of child care in our community. One of the things I've been very keen on is putting the focus of child care on children, because I believe that's where it should land. And so we're going to hear a little bit about that today, as well as helping to comb through some of the challenges in the system with the creation of a comprehensive wait list in one location. So with that, Dr. Burry, I'll turn it over to you for your presentation.
Thanks very much, Chair. As you know, approximately a year ago, we put in front of you the first framework that would look at modernizing Ottawa's system, and the report that you're seeing is in response to the work we've done this year. The province will essentially complete the transition to full-day early learning between 2014 and with it being complete by September of 2015. And that has some significant impacts as we move through. And that's what this entire plan is designed to do, is just help us navigate through that as a city. I think as Chair Taylor indicated, we did hold 4 comprehensive consultations, as well as we received over 450 submissions and comments related to it. So that's the basis of the work in terms of what we're going forward. As part of that work, we established an expert panel, and that expert panel is to provide specific advice on with respect to looking at children and priorities, et cetera. And I want to acknowledge the members of that particular group this morning. I want to particularly thank Colleen Hendrick, who has stepped up in our department, as did many other members, to help with this. This is a very large amount of work to be done, very significant, and not possible just for the Children's Services branch to support it. So Colleen chaired the group. We have Stefania Maggi, who's an associate professor at Carleton University, Elizabeth Christensen, who is also an associate professor at the University of Ottawa, Daphne Cohen, who is chief and research analyst at Health Canada and also has an appointment at the University of Ottawa, Cynthia Correga, who's here today. She's a postdoc fellow at CHEO. She's actually going to do part of the presentation. Huguette Tassier from Ottawa Public Health, Marilyn, who's our manager, Leonore Evans, and again we have a new member, Kelly Pelosi from the Parent Resource Center. So you can see we have a group of individuals who provide us very strategic advice. In addition, we have also set up a stakeholder reference group, which is made up with a broad variety of stakeholders from the city who represent various networks and so on. And Maura Dow is going to present on part of the stakeholders reference group. All of this work is what you see before you in terms of the 2014 plan, which outlines some of our objectives between now 2014 and 2017. What I do want to emphasize is that in addition to the 2014 plan, each year we will bring back a revised plan. So next year in 2015, we will be again presenting to committee a plan which then is submitted onto the province for approval. So as we move through this process, we will be bringing back updated plans. The last thing I just wanted to mention is that the province of Ontario has recently tabled legislation, and we'll be examining that legislation, holding public consultations with respect to that. And this legislation is largely intended to entrench the provincial direction related to childcare and does have some implications for the city and how we operate. The province is becoming more prescriptive in terms of what it wants to see as outcomes, and those particular elements are included in that legislation. And as I mentioned, there will be further consultation conducted by the province with respect to it. So on that basis, I'm going to turn it over to the panel, who is going to do the presentation related to the 2014 plan.
Thank you, Aaron, and good morning to the City Councillors. In the census of 2011, there were 107,575 children in Ottawa aged 0 to 10. Currently, there are more than 27,000 licensed childcare spaces, which serves 25% of all of Ottawa's children in the same age range, from 0 to 10. Licensed childcare is offered in Ottawa in 333 childcare centres and by 17 home childcare agencies. The city provides 6,500 fee subsidies to children whose parents cannot afford the full cost of childcare. Currently, the childcare registry has over 12,900 children and families waiting for a childcare space. Of these children, 5,112 have requested a fee subsidy. So we definitely have a capacity issue in the City of Ottawa for licensed childcare. Looking forward to the demand for growth for subsidized spaces, from 2010 to 2013, the number of licensed spaces in our community has shown marginal growth from approximately 21,500 to 27,000. During the same period, the number of subsidized spaces have actually marginally decreased from 6,600 to 6,500. The demand for subsidy, however, has grown 150% since 2010. As a percentage, the proportion of subsidized spaces has been decreasing. This is in part due to the higher costs of childcare, which includes salaries, foods, hydro, and rent costs. There may be more funds in our system, but over time the city's buying power has and will continue to decrease. As childcare providers, we understand the city's challenge in managing the system so we can continue to support the existing number of subsidized childcare spaces. Also, as providers, we recognize that the childcare system cannot be stabilized if wages are reduced. I'll pass it to Marilyn.
This pie chart depicts the city's childcare budget for 2013. The total childcare budget is almost $95 million. And what's important here is that $77 million of that provincial funding is for core services. That means that the city has 100% flexibility within that core service delivery area, and that's the part of the funding that we're going to work with child providers to define a new local equitable payment for childcare services. Another item of note here is that the city invests more than $10 million of 100% municipal funds for services to support Francophone families, children with special needs, and Aboriginal children within our community. Aaron talked about the consultations that were held following the presentation of the modernization framework in 2013. Throughout the course of the consultations, parents and providers asked us to be clear about the guiding principles for the child care modernization framework. We've done so, and we've clarified and noted our alignment with the provincial early years policy statement. The city's goal is to balance parent accessibility and affordability with service system stability. We have 4 key activities in front of us for the 2014-2015 year. The launch of the new waitlist management technology, which will be complete by September of 2014. The development of new purchase of service contracts with our providers, and those will be complete by December of 2015. A review of our municipal child care program, and that includes municipal home child care, which will be complete by the end of 2014. And then ongoing consultation with our community stakeholder reference group regarding our new funding formula for the municipality. The new wait list, as I mentioned, will be launched by September of 2014, and staff will be contacting parents who are currently on the wait registry in order to update their information. If parents qualify for subsidy, they will then be prioritized based upon when they first registered for childcare. And that's a really important element to parents in terms of their date of registry. The expert panel, as Aaron noted, worked with us to develop criteria for fee subsidy eligibility, and these are described in detail in the service plan. Dr. Quiroga will be presenting this information.
Thank you, Marlon. There are 2 sets of criteria for fee subsidy eligibility. The first set is related to system planning priorities, and they will assist the city in completing its mandate for system planning for children aged 0 to 12. The second set of criteria relates to families' individual priority criteria, most of which are legislated by the province of Ontario. If we look at system planning priorities, the first criteria concerns the geographic distribution of subsidies. Over the next 5 years, the city will strive to achieve a distribution of fee subsidies based on LICO as identified by census data. In addition to this, information will be overlaid from the Ottawa Neighborhood Study, identifying children who score as vulnerable on multiple indicators. Concerning age distribution, also over the next 5 years, the city will strive to achieve ongoing age proportionate distribution of fee subsidies within each neighborhood among groups of infants, toddlers, preschool, and school-aged children. This means that both the city and existing child care service providers will be better equipped to plan for future child care needs while ensuring that existing child care spaces are actually maximized. The city will maintain funding for Francophone families, children with special needs, First Nations, Inuit, Métis families, and the Ottawa Early Intervention programs, proportionate to available funding. The city has chosen to fund these programs above and in absence of provincial funding. Now, looking at priority criteria for subsidy, First of all, city staff will be contacting parents who are currently on the centralized registry and who self-identified as potentially eligible for subsidy to update their information and determine whether they are in fact eligible for fee subsidy. Because of limited provincial funding to support fee subsidies, the city has to use priority criteria to establish eligibility and priority for access to fee subsidies. It's important to note that the first 4 priorities are provincially legislated. So immediate placement is for children who have been referred through the Children's Aid Society, families fleeing abuse, and families residing in or exiting family shelters. The province legislates that financial eligibility must be met. So priority will be given to social assistance recipients, families living below LICO, and families earning between $20,000 and $40,000. The province has also legislated that in order to be eligible for subsidy, parents must be engaged in a qualifying activity, such as employment, studying, or training. Finally, the expert panel identified the following other priorities for fee subsidy: single-parent families, First Nations, Inuit, and Métis families, and families with a child with a documented special needs, or parents with documented special needs.
A departmental task force has been established to review all existing purchase of service agreements within the department, including childcare. As I mentioned earlier, new agreements will be complete by the end of December of 2015, and the contracts will formalize the requirements for operational fee subsidy funding and capital contributions to childcare providers. Any new provincial revenue will be assigned in accordance with any criteria for prioritization of eligible proposals under the approved council program. The city will be conducting a review of the municipal child care program, and in early 2014 the request for proposals was awarded, and we expect this review to be complete by the end of December. As mentioned previously, the goal of this review is to ensure that city-delivered programs and services are efficient and effective. And similar to the community-based child care programs, municipally operated programs will need to work within the new municipal funding formula once it is developed and approved. The review also seeks to preserve municipally operated child care centers that are operating in underserviced neighborhoods in our community.
Throughout 2014, staff will be developing a new municipal funding formula in consultation with the child care stakeholders, and providers and staff will review allowable expenses such as staff wages, benefits, occupancy costs, and other program-related costs with the intention of stabilizing child care services in our city. As part of the initiative to develop a municipal funding formula, a new and transparent reinvestment process was introduced in consultation with the Stakeholders Reference Group early in 2014. Overall, all of these changes are significant for the child care sector in Ottawa. We recognize how complex child care is as a service provider. But local child care providers are committed to working in partnership with the city to move forward on the child care modernization project through ongoing communication.
I'd like to conclude by recognizing the contributions of the parents, child care providers, our academic advisors, and our staff in supporting the modernization framework. Aaron and I welcome any questions from the chair and committee members. Thank you.
Thank you very much for your presentation, and thank you for all of the work that's gone into crafting this. I know whenever we do anything that obviously impacts our child care system, there's got to be a lot of thought put into it and a lot of energy put into managing the different requirements and desires, not just provincial but parents as well. I don't have any questions on this particular file, although I've had the benefit and the opportunity of kind of being involved in it. Members of the committee, are there questions for the staff on this at this point? Vice Chair Kadri.
Thank you very much, Mr. Chair, and thank you very much for the presentation and for all of your work on this item. And I think reading the report, obviously you covered almost all of the issues that you needed to look at, both from a funding perspective as well as looking after the children, which is the most important piece in all of this. Having said that, just one question, Dr. Bray, and I shared an email with you this morning from a resident. I just want to make sure that there are components in this program that are not addressed in this report, that they will be looked at going forward before we get a final copy of a program or item going forward.
Yes, that's correct. There's many things I think particularly related, and they were talking in the funding formula areas with respect to the funding. The notion that's been introduced relatively recently by the province of Ontario is no longer to sort of fund separate envelopes of things, but to combine it all and to give it to us and now say, go back and look at this. And I think the challenge for us is to make sure that we're doing the most we possibly can with the dollars that come in, and that's why we are having the discussions with the stakeholder reference group to look at how we're actually going to fund and keep as much stability in the system as possible.
Thank you very much, Dr. Burry. Thank you, Mr. Chair.
Thank you. Anybody else? So our first speaker on the item then is Christine Bardella. I may have mispronounced that, I'm sorry, from the Ottawa Child Care Association. Christine, if you want to make your way down over here to the public delegation seat, and when you're ready to speak, just hit the button on the microphone in front of you, and that way the folks out in internet land can hear you as well. And you have 5 minutes from when you begin, and we'll signal you when you're getting close to the end.
Good morning. As an OCCA representative, I appreciate this opportunity to present to you this morning. The Ottawa Child Care Association, OCCA, represents over 50 nonprofit child care centres within the City of Ottawa, and we have been a collective voice for centres within this service delivery model since 1973. Our mandate is to promote and advocate for accessible, nonprofit child care in order to meet the needs of children and families, to educate the general public and politicians to the benefits of licensed nonprofit child early learning and care, and to advocate for appropriate salaries, benefits, and working conditions for child care staff, which would be comparable to those in similar professions. OCCA recognizes the Child Care Service Plan is a consolidated work of objectives and focuses, and we expect that the City will continue to consult with the child care community through the Stakeholders Reference Group and ensure that the ideas and opinions presented by this group are taken into account when continuing to develop the plan. We applaud the City's direction in ensuring that it will give priority access to child care fee subsidies to families most in need, and we endorse the City's recommendation that subsidies follow the child. Although the province is the primary funder of subsidized child care services in Ontario, the City of Ottawa also plays an important role by contributing funding and identifying how that funding is allocated. We applaud the City for identifying they are committed to supporting not-for-profit child care as stated within this report. We fully expect that the City will continue to ensure that public dollars are not flowed to for-profit operators. Public funding must only be allocated to nonprofit agencies that are accountable to the City and their community. We want to make it very clear that if the City moves to a standardized funding formula that reduces our current operating budgets, there may be unintended consequences. As you know, there continues to be a high demand for childcare spaces. If the daily per diem rate for subsidized spaces does not meet the operating expenses, that may leave our most vulnerable children at risk of very little or no care being available to them. We would like to recommend that the City, in conjunction with the Stakeholders Reference Group, review the implementation of base funding, thus ensuring that there is at least a minimum number of subsidized spaces based on demographic need reserved in high needs areas, thus protecting the availability of those spaces for our most vulnerable children. We encourage the City to investigate, as part of their process of determining a standard funding formula, the feasibility of establishing a citywide salary scale for RCEs in Ottawa. Given that, on average, salaries account for 77 to 84% of each agency's operating budget, and the increased recruitment and retention challenges for qualified staff with competition from the school board, a citywide salary scale will increase stability and predictability of costs. Any decrease to salary or benefits is against the premise of pay equity and may violate the pay equity legislation. In building a sustainable future for all children and families, we would like to see the city take more of a leadership role in system planning. On page 7, the report states that in geographic areas where there are no existing not-for-profit operators and not-for-profit areas providers are not willing to shift their services offering, the city will review the potential for a purchase of service agreement with a private operator. Non-profit operators are more than willing to shift their services to where there is a need. However, to be able to do this, there must be system-wide planning and funding for the expansion of non-for-profit childcare services. With the planning and development of future communities, we would suggest that childcare be part of the initial planning process, the same as schools and parks as designated from the onset. The city has minimal available funding for capacity expansion to meet the existing, let alone the future demands of childcare. Thus, it is imperative that the city begin having system-wide planning discussions in conjunction with the stakeholder reference group, the city planning department, and developers to ensure that we are building a city that meets the childcare needs of all children and families within the nonprofit sector. Thank you for your time this morning.
Thank you very much for your input. And I would like to just ask Dr. Burry to comment. You spoke a couple of times about system-wide planning. And I'd like to, we've had internal conversations about that quite a lot, and it was a topic that we talked about at some of the roundtables with parents as well. So I'd like Dr. Burry to kind of comment on our kind of position in the child care market now, the city, versus, what it may have been, some time ago. Specifically with respect to the systems planning piece. Dr. Burry?
There has been a significant shift in terms of where the province of Ontario particularly has gone with respect to childcare, which has impacted us. And primarily it was the introduction in 2007 of income testing. So the majority of the resources and the emphasis of the province of Ontario is very much on the low-income community. And it is not at this particular point in time trying to build an entire childcare system across the whole spectrum. Having said that, we are very much focused, and that's where in our presentation we talked about very much looking at what is the distribution and the planning for the system across low-income neighborhoods, across all neighborhoods. Much of our system currently is historically based, and we need to be re-examining that and developing a system that's more flexible, that allows the services to go where the children actually are. It's going to take time to do that, and we're going to systematically go at this. The first piece, which we spoke about earlier, is the key step, and that is we have to get the right wait list information of who's waiting for what kind of services and where they actually are right now. We don't have that full detail, and we'll have that over time and then begin to migrate the services. The other piece of this, and we're very hopeful at this point, is the province has announced some new funding for us. We have not seen the details around this. The net increase for us would be about $3 million more in service than we currently have, but we don't have the details, and I don't expect to have that until after the annual cycle for the province, which is usually sometime well into April, where they'll provide us with the details on where we actually can do that kind of expenditure. So there were a number of points in the presentation. The first thing is the stakeholders reference group is going to be seized with dealing with all of those issues over the next year. We haven't finished those conversations, and we anticipate that the stakeholders reference group as the expert panel will continue to be an ongoing part of how we're going to do business going forward. We want this to be an extremely transparent process. We are releasing all the information, all the notes. It goes out to anyone who requests it. We want people to understand what's actually happening, and I think Maura indicated earlier very clearly, it's a very complex business, and there's a lot of things happening out there in the sector. So going forward, we very much are going to have to focus on what those provincial priorities are, which are on low-income subsidy, and that represents about 25% of the total share right now in the city. The other 75%, we don't have a lot of control or input as to where their child cares are established or how they're established.
Okay, thank you very much, Dr. Burry. Are there questions from other members of the committee? Thank you very much for your presentation. The next is Ms. Joanne Hightower from the Ottawa Federation of Parent Daycare. Ms. Hightower, if you want to come on down. And again, you have 5 minutes. Please activate the mic in front of you when you begin to speak. Thank you.
Good morning. I am Joanne Hightower, and I just wanted to follow up on the comments by my colleague, Christine Spardella. The OFPDC, or the Ottawa Federation of Parents Daycare, is a group of 9 not-for-profit cooperative childcare centres who've been providing long-term quality service to families in the City of Ottawa. The OFPDC supports the prioritized wait list, but we feel that the choice for parents must be held within the not-for-profit sector. Otherwise, we too feel that public dollars will flow to the for-profit sector, and there will be a loss of accountability for public tax dollars. Historically, the City Council has always supported the not-for-profit sector and funding going to that sector, and has indeed mandated said in previous councils. Standardized funding formulas not only will put childcare centres at risk, but it could also put our most vulnerable children at risk, because with the standardized funding formula, we feel that in order to meet the funding shortfalls that could potentially come out of this, we'd be looking to providing care more often to the full fee paying parents rather than the subsidized parents because of the differential in the imposed funding structure. We feel that the city must continue to take a strong leadership role to ensure a cohesive system of planning that includes the not-for-profit sector for the future of our families and our children. There's been a lot of discussion today with regards to system planning and quality measurements. We know that research studies such as the early years study by Dr. Fraser Mustard and Margaret McCain, that there are high indicators or higher indicators of quality within the not-for-profit sector. At present, there are no quality indicator tools attached to any public funding within the childcare sector, and we highly recommend that within system planning, the city ensure that a quality insurance tool is implemented. Thank you.
Thank you very much. Appreciate your insight and your input, and I know that, or at least I suspect, you're feeding into that process in the tables as well. So thank you for sharing that, not just on your behalf, but on behalf of the not-for-profit sector, nonprofit sector. Are there members of the committee with questions for this delegation? No? Thank you very much. And the last delegation we have registered is Tamara Brown from Brown Bear Daycare. Ms. Brown, you want to, if you were here? All right, let's try again. Is Ms. Brown here? Tamara Brown? Oh, yes. Okay, I'm sorry. Come on down. Right over here to the chair at the front, and you have 5 minutes from when you begin. Please just hit the button in front of you to start the mic. Go ahead, hit it again. It was already on.
Good morning. I'd like to thank you for this opportunity to speak to the committee today. I am the Executive Director of Brown Bear Daycare, we are a private center. We operate 3 private centers in Stittsville. I'm also a member of the Stakeholders Reference Group. I understand through our Stakeholders Reference Group meetings that although there are many budgetary considerations inherent in moving toward a floating fee subsidy system within Ottawa, we all feel, as indicated by Ms. Spardella with the Ottawa Child Care Association, that this floating system supporting parental choice is a positive leap in childcare modernization. The report being considered today specifically states that when the wait list is fully implemented, all child care agencies will be able to offer subsidized spaces with a signed agreement with the city. I want to ensure that the priority of parental choice remains intact within this report. I need this committee to understand that parents do seek subsidized spaces within private centers. In my own community of Stittsville, my centers receive requests for subsidized spaces weekly. For the past 8 years, I've had to advise them that our centers are not eligible to enter into purchase of service agreements within the city because of our auspice. Parents in my community look to us in the private sector, too, to strive for quality child care and to do our utmost to protect the integrity and quality of child care in their community. While this forum really isn't my wheelhouse or isn't in my comfort zone, I feel I would be remiss if I didn't advocate for my parents in my community by asking the committee to uphold the integrity of this report's priority of parental choice, which is real and true parental choice. So if they do want a space at my child care center because of the reputation I have within the community, because of referrals they receive from their family members and their friends, I don't think that it is appropriate for them to be told they don't have that choice because the city controls the purse strings. Thank you.
All right. Thank you very much, Ms. Brown. Are there questions for Ms. Brown? No. Thank you very much. So with that, that's the last presenter we have on this item. So I'll turn it back to committee, and if there are no questions for staff then on this, may we approve this and carry it forward to council? Carried? Carried. Thank you very much. Appreciate Dr. Burry and his staff coming out and taking the time, and the delegations for coming out as well. Moving forward, then, we have notices of motion for consideration at subsequent meetings. Nope. Seeing none inquiries. I believe, Councillor Tierney, did you have an inquiry? I'll forward it. Okay. I'll forward it through staff. Other business? And we're adjourned. Thank you very much.